Hello everyone, welcome to Patho Excellence and welcome to 100 plus histopathology pattern series. In this episode 2, today we are going to discuss Syncytial pattern, Alveolar pattern, Acinar pattern, Tubular pattern and Cribriform pattern. In previous video, we have discussed all these 5 patterns: Zell ballen, nesting, trabecular, organoid and solid sheet pattern. So you all know in this series we are going to discuss all the neural spindle, vascular growth patterns and stromal patterns along with special cell patterns one by one in different episodes. So let's see what are the today's patterns. So first is syncytial pattern, second alveolar, third acinar, tubular and cribriform pattern. So normally if you see, these patterns are seen in normal structure of our body. So first pattern is syncytial pattern. So syncytial pattern normally seen in placental tissue, which in placenta syncytial trophoblast are arranged in syncytial pattern, and if we see similar pattern in malignant tumor, it is medullary carcinoma of the breast and many other tumors. Second is alveolar pattern. So alveolar pattern mostly it is resembling to the normal appearance of alveoli of lung. So commonly seen in alveolar rhabdomyosarcoma and soft alveolar soft part sarcoma. Acinar pattern. Normally prostate shows a small acini in normal histology along with the prostatic adenocarcinoma also show this acini pattern, and this acini pattern normally present in some endocrine glands like pituitary as well as in the pancreas gland. Kidney breast shows tubular pattern. So these tubules normally in kidney we are seeing like distal connecting tubule, proximal and collecting duct. So it which shows tubular pattern. So this is the pattern also seen in tubular carcinoma of many organs. Now cribriform pattern. This is not a true normal counterpart but adenoid cystic carcinoma and Gleason pattern for prostate carcinoma is showing cribriform pattern. So let's start with the syncytial pattern. So syncytial pattern is characterized by large cohesive sheets of tumor cells with important thing is indistinct cell border. So which gives the appearance of multinucleated syncytium, and here individual cells are present, their cytoplasmic borders are poorly defined and they giving appearance they like that the cells appear fused. So whenever we see normal placental tissue, these are the cells called syncytiotrophoblastic cells. So these cells are merged together and there is no cytoplasmic border visible uh, like syncytiotrophoblast. Cytotrophoblast. Cytotrophoblast will have a distinct cell border. So here you can identify difference between syncytiotrophoblast and cytotrophoblast. Cyto means which is having properly visible cell border, whereas syncytiotrophoblast are having indistinct cell border. So this is called syncytial pattern. So here you can identify, see, cells are visible but you cannot appreciate cell border because they are fused together and its appearance is like having a single cytoplasm and multiple nucleus are sitting together. So this is called syncytial syncytial pattern. Now what are the classical tumors which shows this pattern? One is medullary carcinoma of breast, lymphoepithelioma, nasopharyngeal carcinoma and meningothelial meningioma. Along with this tumor, some poorly differentiated carcinomas may show this pattern. So what are the associated features? Mostly in this tumors like medullary carcinoma of breast and lymphoepithelioma, there is dense lymphoid infiltrate in between this tumor syncytium, and this is having high mitotic activity. Nuclei are large and vesicular. See, here in this you can see this is the tumor part where cells having syncytio or syncytial pattern. So you cannot identify uh, actual border of the cell, but all the cells are fused together and indistinct cytoplasmic border, and only you can identify nucleus, and nucleus is having vesicular chromatin, and here in this syncytium you can identify lymphoid infiltrate. So many lymphocytic infiltrate in between this syncytial. So here also you can identify in low power view, these are the sheets of cells and they are having indistinct cytoplasm, and in between these sheets there is stromal separation and it contains dense lymphoplasmacytic infiltration, and here you cannot identify any well formed gland or glandular lumina. So this is medullary carcinoma of breast. So let's revise what is syncytium. Syncytium where the cytoplasmic border is indistinct and no visible membrane is seen. So if you compare with the cell epithelium, then you can identify this type of cytoplasmic border, whereas in syncytium no border. And this is the example of meningoencephalal meningioma where multiple solid uh, areas of the cells having syncytia pattern, and this is fibrous septa. Along with in the meningeal meningioma there will be psammoma bodies and some whorl formation. So in histologically you can identify these are the syncytial nest of the cells, and this is the fibrous septa. So fibrous septa and syncytial sheets. So again this is high power view where you can identify indistinct cell membrane of the cells, abundant eosinophilic cytoplasm, vesicular nuclei, some of the cells show prominent nucleoli, mitosis may be seen in some of the cells, and they are appearing like merge with one another, and in between these syncytial sheets lymphoplasmacytic aggregates are seen. So what is the mechanism? Well, here because of poorly defined intercellular boundaries is because of abundant cytoplasm, close cellular cohesion and minimal intervening stroma. So will you differentiate it from solid sheet? Solid sheet, in solid sheet cells will have a distinct cell border. Syncytia having indistinct cell border and cells appear fused, whereas nest pattern having cells arranged in discrete small to large nest. Now alveolar pattern, which is common in alveolar soft part sarcoma, and its appearance is also known as pseudo alveolar appearance. So what is the actual alveolar pattern? Here the cells are arranged in well defined nest separated by thin fibrovascular septa, but here the important point is loss of cohesion in the center, which creates or forms spaces that resemble pulmonary alveoli, right? So here you can see these are the nest of the cells, but you can identify the nests show discohesion in the center. Discohesion means cells are separated from one another from the uh, from the boundary of the nest, right? So on the boundary you can identify cells are adherent to the border, but the central portion shows discohesion and which creates a space formation. So it resembles normal lung alveoli where you can identify the alveolar lining and air filled spaces in the lung. But here in this tumor, you can identify peripherally bound tumor cells and centrally space in which you can identify the discohesion of the cells. So, fibrous septa which divides tumor into nest but centrally detached cells and which create empty space resembling alveoli. This is the example of alveolar rhabdomyosarcoma, and the central discohesion result in pseudo-alveolar like structure. So here you can identify space in the nest, and these are the tumor cells with pleomorphism. Now, high power appearance where you identify peripheral cohesive tumor, central discohesiveness and delicate septa in between the nest, and frequent mitosis is seen. This is the high grade tumor which is in alveolar soft part sarcoma. You can identify this pseudo alveolar space. So here you can see this is the tumor nest where these cells are adherent to the septa, but these are the discohesive cells, and because of that this space is created, and this is called alveolar cell pattern. So what is the pathogenesis? Loss of intercellular adhesion causes central tumor cells to fall away from the septa, and classically remember alveolar rhabdomyosarcoma and alveolar soft part sarcoma which is having pseudoalveolar appearance. So if you go for IHC in alveolar RMS, then myogeny, MyoD1 is positive and Desmin is also positive. So this is the alveolar rhabdomyosarcoma where you can identify central discohesiveness of this cell, and there is degeneration of the centrally placed cells. Some of the area shows necrosis, and this is creating a alveolar space, and the peripherally located cells are bound to the septa. And now third pattern is Acinar pattern. So Acinar pattern by definition it is consisting of small round glandular structure resembling acini of pancreas, which is lined by epithelial cells and surrounding a central lumen is present. So when you see small lumen and surrounded by cells, this is typically lined by single layer of cuboidal or columnar cells with basal nuclei and centrally placed lumen. So this is the normal histology of pancreas. You can identify these are the small acini where you can identify these are the nucleus basally located and centrally placed space which is filled with some secretion. So this is called acini. So here you can identify lumina, and these are the different small cells. And in normal pancreas is identified this by this acini, and this is called islet cells, right? So there are two types of cells, islet cells and acini cell. Now this similar pattern is also seen in acinar cell carcinoma and lung adenocarcinoma. So here also you can identify these are the acini with centrally lumen, and here in adenocarcinoma this is the lumen surrounded by this tumor cell. So whenever you see small lumina with which is surrounded by mostly single layer of cuboidal to columnar cells, it is called Acinar pattern. Yes, whenever you say pattern name, there must be repetitive pattern. So multiple areas show similar pattern. So you can describe this as a particular pattern. So multiple acini if you find, then it is acinar cell pattern. So here also this is a again slides where you can see numerous small glands are seen. So multiple repetitive numerous similar appearing glands are seen, uniform architecture and having well formed lumina, and they are closely packed. So this is a case of CA prostate where you identify this type of the tumor cell arrangement with acini in this section. So here this is the normal architecture of the prostate, and here the tumor part showing acini or acinar pattern. So this is the adenocarcinoma of prostate. In high power view you can easily identify this lumina surrounded by single layer of this malignant cells, cuboidal in nature and maybe columnar in some pattern. There is open glandular lumen and sometimes you may find secretion in the lumen. So in CA prostate, will you uh, define CA prostate? Mostly the tumor cells retain glandular forming capability and resembles to normal secretory epithelium. But whenever there is two layered epithelium, means whenever you find double layered, means one is secretory which is columnar and basally located basal cells. So two layered appearance is there, which is normally a normal prostate show. See, this is the columnar cells and this is the basally located. So two layered epithelium, it is normal. But whenever malignancy is there, you can find closely packed acini but without basal layer. Only and only the single layer nucleus, single layer gland is seen and absence of basal cell, right? So double layer with centrally or here you can infolding of the epithelium in the normal prostate, but here single layered small acinar pattern seen in the Gleason 4 this prostate adenocarcinoma. Another common tumor which shows acinar pattern is lung adenocarcinoma and salivary gland tumors. Histologically, round glands, central lumina, infiltrative. So here you can identify. See, this is the normal. This is the normal prostate area, and these are the infiltrative acini which is in the normal area, and yes, absence of basal layer in the prostate carcinoma. Now differential diagnosis, when you say tubular, which we are learning in next slide, which is having elongated glands, acinar pattern, small round glands and cribriform pattern. Again we are discussing in next slides, which is having multiple punched out lumina. So now let's see tubular pattern. So tubular pattern, as the name suggests, it looking like elongated tube. So which often shows branching and it infiltrates surrounding stroma and resembling normal kidney tubules. So you can see these are the normal tubules of the kidney. So if you find this type of tubular appearance in malignant or any tumor, then it is called tubular pattern because of normal kidney like tubular appearance. So here you can see this is the glandular pattern or glands. You can identify small glands here. But here this tumor part shows elongated tubules with some angulation, some branching. So this is called tubular pattern because it is having elongated tubular or elongated lumen, right? So this is a case of tubular adenoma of intestine. So in low power view, you can see long tubular glands and sometimes branching and angulation, and in between this tumor there is some fibrous stroma, mostly in the breast carcinoma, tubular carcinoma of breast. Here this is the gastric adenocarcinoma showing tubular pattern, and branching and angulation is common in the tubular adenoma and tubular carcinoma. So here you can see in this section multiple elongated tubule with branching and angulation, and it is infiltrating into the surrounding stroma, which is mostly here you can identify fat and sclerostroma, pinkish sclerostroma. So this is the case of tubular carcinoma of breast, which shows low grade cytology and multiple tubules. So here you can see sclerose and fibrostroma, and separate tubules are seen having elongated lumina, and some of these show a small gland or acini like pattern. So high power, in which you have to see first of all elongation of the gland or tubule like pattern, single layer or multiple layers of epithelium with well defined lumina, atypia, as well as sometimes mucin may be seen. So common examples are tubular carcinoma of breast, colorectal, gastric and endometrial carcinoma shows this type of appearance. And acinar glands are round, which we have seen in prostate, and where tubular glands are elongated. So here this is again a tubular carcinoma of breast. The characteristic features, if you see in this tubule, it is having this lumen, and most important finding is having sharply tapering end of the tubule. Whenever you find this type of tubule, always suspect tubular carcinoma of breast, and in this tumor you will find sclerostroma. And again in this section of a lymph node, you can identify lymphoid architecture and infiltrating tubules are seen. This is the lymph node metastasis by tubular carcinoma of breast. Now last pattern, Cribriform or sieve-like pattern. So what is Cribriform pattern? It is large epithelial nest which contains multiple uniform punched out lumina which create a Swiss cheese or sieve-like appearance. So this is a pattern or in like Swiss cheese means this is a cheese, and here you can see this is a punched out lumina, and even in sieve-like appearance or it is resembling like sieve, where you can find this type of punched out opening. So this is classic example of this cribriform pattern A tumor is adenoid cystic carcinoma of salivary gland, where you can find multiple sharply defined punched out lumina and surrounded by tumor cells, and these are having nest pattern, but nest contain sharply punched out lumina. So this is adenoid cystic carcinoma. So you can see large epithelial islands and numerous round holes and uniform architecture with minimal intervening stroma. So here you can see this is the boundary. This is normal acini of the salivary gland, and here you can find these are the malignant tumor, adenoid cystic tumor, which shows adenoid cystic pattern with multiple holes. So this is normal and this is tumor part. Again in high power view you can see tumor cells. These are the tumor cells, and which is having pseudolumina because the nest, what is the mechanism here? Because here there is fusion of adjacent glands. So nearby glands are fused together and form multiple secondary lumina within this epithelial nest. And sometimes you can find hyaline or mucinous material filled this lumina, and the basaloid cells are visible in adenoid cystic carcinoma. So examples of this tumor pattern are: one is adenoid cystic carcinoma, second is adenocarcinoma of prostate, where Gleason pattern 4 show this Cribriform pattern. Gleason 2, 1, 2 in pattern you will see mostly Acinar pattern. When they fuse together, they form Cribriform pattern and called Gleason pattern 4. DCIS or ductal carcinoma in C2, where Cribriform pattern is common, where you can find this type of punched out lumina in the nest. And some invasive cribriform carcinoma also seen in breast carcinoma. And another example is cribriform morular thyroid carcinoma. So here you can see this is the tumor part here, and here this is the normal thyroid gland which shows follicles filled with the colloid material, and here this tumor shows multiple punched out areas, and this is called cribriform pattern, and another name is cribriform morular thyroid carcinoma. In previous classification, this carcinoma was considered under the variant of papillary carcinoma, but in newer classification this is the separate entity, and it is the name because it is having a cribriform pattern. So in differential diagnosis, where you find lumina, one is Acinar, which is having single central lumen, small in size; tubular, where elongated lumen; and cribriform, where you find multiple punched out lumina. So we have discussed all these three patterns. In next topic we will discuss papillary and micropapillary pattern. Now what you have to remember is syncytial pattern, where indistinct cell border is there. Common example: medullary carcinoma of breast, nasopharyngeal carcinoma; alveolar carcinoma, where centrally cell drop out is there resembling lung alveoli; and alveolar rhabdomyosarcoma and soft part sarcoma. Acinar pattern, small round glands with one lumen, prostate adenocarcinoma. Tubular pattern, elongated branching glands, where tubular carcinoma of breast and tubular adenoma as well as carcinoma of GI tract, and Cribriform pattern, which is having multiple punched out lumina giving Swiss cheese or sieve-like appearance, mostly in adenoid cystic carcinoma and Gleason 4 prostatic carcinoma. So remember these all patterns. So today we have learned all these important and interesting patterns, and you have to remember which normal organ is showing this similar architecture and pattern. So here I have given this table to remember the normal pattern in normal organ as well as tumor shows this similar appearance. So in next episode we will cover papillary, micropapillary, villus, tubular villus, follicular, and pseudofollicular and pseudopapillary patterns in detail. So if you found this video helpful, like, share, subscribe to Pathology channel, and keep learning one pattern at a time, and observe the pattern, recognize the diagnosis, and report with confidence.